Hello there, my name's Dr. Andy Knox. I'm one of the partners at Ash Tree Surgery in Carnforth, which is part of the Federation of Practices working together across North Lancashire. Also part of the Better Care Together programme around Morecambe Bay, where we're really trying to provide the best care we possibly can for our patients. One of the things we see really commonly as GPs is a skin condition called eczema. Now, eczema fits into a family of illnesses alongside hay fever and asthma, which is often when your body is overreacting to things in the natural environment and causing you some problems. What happens in eczema is that your skin is made up of loads of different layers, and the top few layers are very oily, protective layers. Now, in eczema, your skin reacts so that you lose the very oily protective layers, which then makes your skin more prone to getting irritated and very itchy. There are loads of things that you can do to take care of your own skin. Firstly, find out and work out what it is that your skin is reacting to. There are some things you might just simply need to be avoiding. Lots of people, for example, react to the starch on potatoes when they are peeling them, and just by wearing rubber gloves when you peel potatoes can make a huge difference. For some people, it's certain detergents or soaps or shower gels. The things that irritate your skin need to be avoided, otherwise they're going to continue causing you a major problem. For some people, though, there are food intolerances that can also be found causing skin reactions. Just avoid those food types and you'll find your skin feels much better. One of the classic things we see is a slight lactose intolerance. And actually, if you rest your skin from milk products for a few months, it often gives your body the chance to recover and stop being so reactive to it. But when your skin is flared up and it's itchy and it's sore and it's dry, there are some really simple things that you can do yourself that means you don't need to come and waste your time having to find an appointment with a GP, which can be hard to find at the best of times. So the most important and vital part of caring for your eczema is finding an oily cream that suits you. Oily creams basically fit into two categories. You can either get ones that are slightly more water-based. The advantage of them is they feel kind of nicer to put onto your skin and they soak in quite easily. However, they're not quite as effective as the other type, which is a more oily-based option. The water-based creams would be creams like E45 or zero base, Dipra base, double base, cetamacrogol. There are plenty of other choices as well, and you can talk to your pharmacist about them and actually play around with creams yourself. There's another similar one which is called Aveeno, which doesn't have any petroleum chemicals in. Some people find they react to the petroleum chemicals, and so that can be another alternative. And again, pharmacists will be able to advise you about that. With more oily-based creams, what I mean by those are things like Vaseline, emulsifying ointment, Hydromol. Again, there's a plethora of other examples that you can play around with. But the most vital part in looking after your eczema is to get as much of the oily cream into your skin a day as you can. We would say a minimum of twice, actually 4 or 6 times a day. Putting an oily cream, getting this protective layer back onto the skin is absolutely vital. The second thing to remember is when your skin has flared up and it's angry and it's red and it's itching you like crazy, get a steroid in there, but make sure you use a steroid cream properly. Again, over the counter, you can buy hydrocortisone. You can get it again as a cream or as an ointment, whichever one you prefer the feel of. It's just as effective either way. And you put it on and then put your emulsifying cream on top, or the other way around. It doesn't actually matter. But when you're getting an itchy flare-up, use a steroid cream on there nice and quick, but don't just use a little dab and then leave it a few days and put another dab on. Otherwise, you'll be using it for a long time and that can thin your skin down. Most professors of dermatology would now say blast the skin with steroids for a few weeks to really get on top of the eczema, and then you'll find your skin is free and clear for ages. So when your skin flares up and it's very itchy and sore, get some hydrocortisone over the counter and then apply it twice a day for 2 weeks, then once a day for 2 weeks, and then every other day for 2 weeks. You'll find your skin is much better. However, if your skin isn't improving, it might be that you need a stronger steroid, or it might be that it's a bit infected. When your skin's infected, the skin will often be broken open and it will often have signs of yellow crusting. That's due to a bacteria called Staphylococcus aureus. That needs an antibiotic cream, or even sometimes in worst case scenarios, some oral antibiotics, and you will need advice from your nurse practitioner or GP about that. And we'll normally give you some kind of course of flucloxacillin, or if you're allergic to penicillin, another antibiotic called clarithromycin or something similar to that. So, take care of your skin. Make sure that you are avoiding things that flare it up. Be careful with what you wash with. Make sure that your shower gel or soap is not something that's actually making your skin worse. Always go for a more gentle soap or something that will not cause your skin to be sore. Make sure that you're using a really good oily cream or ointment as regularly as you can to get those protective layers back into the skin. When it flares up, hit it early with a good steroid cream like hydrocortisone you can get over the counter and blast it for a few weeks. But if it's not improving, or it's really itchy, or it's obviously infected, that's when you need further advice from a nurse practitioner or a GP. We want your skin to be lovely and healthy and not irritating for you, so take good care of it, and I hope your skin's feeling better soon.